So am I audible, guys?
Yes, sir.
Yeah. Okay. So I hope everyone is connected. So for example, Shubham, and then Suman, Monica, Priya, Tamil Selvan. Okay. So everyone is there. Okay. So yesterday we are discussing two topics. One is pacemaker, and then another one is we are discussing the ECMO procedure. So I hope you guys, everyone is clear on this, and I'm receiving few answers also. So who are all not sending answer, you guys check and send the answer for that. And then today we have to discuss CABG as well as some of the important exam questions is there. So we have to discuss, guys. Right. So today we complete the cardio. Okay. So we directly go for the topic, the CABG. So can anyone tell me what is CABG, guys? CABG mean anyone? No idea.
Coronary artery bypass graft.
Yes. So the CABG mean coronary artery bypass graft. So this is one of the major surgery in cardiovascular system, and mainly for which condition the CABG is performed mean the condition name is CAD, right? Coronary artery disease. Whenever the patient having CAD, that time the provider performs CABG. So very simple, the procedure how they are doing mean we have the special artery in heart, right? It's called as coronary artery. In this coronary artery, because of plaque formation or calcium deposit, the patient getting blocked in that particular artery. So if the coronary artery having block mean the blood supply will be stopped. So in that location, if blood supply is not there mean, so because of lack of blood entirely, right? So entirely the cell death will occur. It is very big issue also. So provider what they are doing mean normally the CABG procedure the provider perform two scenario, guys. You guys remember that the provider will perform two procedure. What does that mean? One is they are doing grafting, and another one is they are doing harvesting, which mean harvesting mean they have to pick the artery, right? Harvesting mean they have to pick the artery or vein from other location, and grafting mean where they have to place. This is the difference. Once again I repeat, harvesting mean where they have to pick artery or vein, and then grafting mean where they have to place. This is the difference, right? Okay. So in this CABG we have three set of code sets, guys. If the provider doing only artery mean you have separate code, only vein mean you have separate code. If both artery and vein combinedly they perform mean you have separate code. So you guys having three different code sets is there. So what is the advantage mean in these three? First we are discussing vein. If you guys understand vein alone, right, how to code the CABG procedure in vein alone, if you guys understand, remaining all the two is the same, guys. It's a Xerox. So we discuss one by one. So I'm already informed. If you want to code CABG, you have to check few things. The first one is you have to check which one the provider perform, either artery or vein or both artery and vein. Like that you have to check. And second one, how many graft the provider perform you have to check, right? 2 graft or 3 graft, whatever you have to check. And then the next one, you have to check grafting or harvesting. But don't forget guys one thing. What does that mean? All the scenario the provider perform grafting and harvesting both. But whenever you have to code, first you code grafting code, next you have to code harvesting code, because harvesting codes are add-on code, so we are not using as a primary. That's all. Clear? That's all guys. Okay, now we discuss one by one. The first one is a vein only. Okay, so this is a vein grafting code. Vein grafting code. You guys see the screen and tell me if the provider performs CABG into 3 vein graft. What is the answer, guys?
33512.
33512.
That's all. Okay, in case 7 vein graft.
33516.
That's all, guys. This is CABG coding. That's all. You guys, nothing will do. Directly, how many graft they perform, you check and you have to code accordingly. That's all. You guys clear? That's all. So, you guys, nothing have to do. Whatever the graft the provider mentioned, you just check and you have to code accordingly. That's all. Clear? Okay. The next one is the harvesting. So harvesting mean I'm already informed where they have to pick the vein. This is called as harvesting. So the harvesting of Stephanus vein, it's included in CABG procedure. So other than Stephanus vein, anything the provided document you have to code separately. What does that mean? If any upper extremity vein, open approach, if they are performing, you give 35500. If endoscopy mean 33508. And in case the provided documented femoropopliteal vein mean, you have to go for 35572. So this is the code sets. Okay. Now you guys know harvesting of vein and grafting of vein. Okay. Now I will give one question and also I will explain how to code the answer. Then you guys easily understand all these things, guys. Right? Okay. So please note down, guys. You guys please note down. The question is, okay, the question is CABG into 3 vein graft. CABG into 3 vein graft. CABG into 3 vein graft. One harvested from Stephanus vein. So CABG into 3 vein graft. 1 graft harvested from Stephanus vein. And 2 graft harvested from femoropopliteal vein. 2 graft harvested from femoropopliteal vein. Clear? Okay. Now, so as per the guideline, we have to code first the grafting code, right? You guys tell me what is the grafting code for 3 vein graft?
Three three five one two.
Okay, so 33512. You have to note down 33512, and then so grafting is enough. The next one is the harvesting. So harvesting, Stephanus vein, can we code, guys? Can we code Stephanus vein? Right? We don't code. So Stephanus vein, we don't code. If you want to code also, we don't have any code. So just leave that. Then the provider using femoropopliteal vein. What is the code for femoropopliteal vein, guys?
35572.
That's all. So 35572. That's all. So the overall answer is you have to use double 3512, comma 35572. That's all, guys. So that's all. You guys understand? Whenever you have to attend CABG, very simple, guys. First, you have to code the grafting code. How many grafts the provider perform, you have to code. After that, harvesting you have to use. That's all about CABG. But many of the candidates, they are getting, okay, maybe it is very difficult, like that they are thinking. Guys, actually the CABG is one of the easiest procedure. Very easiest one. So you guys, nothing will do. Just grafting and harvesting, you check and code. That is enough. Okay. So next one is the artery. So artery also same, guys. Xerox I said, right? So see, grafting code and then harvesting. So actually harvesting is very easy comparing to the artery, vein, because in vein you have some code for the harvesting of vein. But in artery, you guys no need to code anything. See, you guys see your slide. Very simple. Harvesting of all artery, including in the artery procedure, except radial artery. Right? So harvesting of all artery, including in artery procedure, except radial artery. Which means whatever the artery the provider mentioned, you no need to code anything. Only the radial artery is billable, remaining all the arteries included. So you guys nothing will do. Sometimes if the provider documented bilateral, if they documented, that time you are using 50 modifier. That's all, guys. That's all about modifier artery. The CABG artery code. So you guys, everyone is clear, right? Still now, guys, very simple. Whenever you are attending any question from CABG, first point you check whether the provider perform artery or vein, which graft they perform. In case vein graft they perform mean, you have to code that vein grafting code. Then whatever the harvesting they mention, you code harvesting also. The next one, if artery grafting alone they perform mean, you just check the artery how much graft they perform, as well as you have to check the harvesting also. You guys, everyone is clear still now, right? Because these two is a very simple, and we are not having the exam question. This is very rare in your exam. But next we discuss one thing. It is very important for your exam. What does that mean? The next one, what does that mean? The next one is artery and vein, both. Whenever artery and vein, both the provider will be performing. Whenever artery and vein, both the provider is performed, that time you have to use, we have to follow some other set of guideline. So before that, just to give me a time, guys. I think some candidate is not connected. Hitesh. Guys, this guideline is very important, guys. Both artery and vein, it is very important. Wait, I will show you now. I think he's tried to connect again. Okay. So, in case in your question, the provider documented I am performing only vein or I am performing only artery. Like that, if they are documented mean, so no issue. You have to code that single code. But in case in your exam, if the provider documented both artery and vein together, you guys clear? Both artery and vein together, that time you have to follow one guideline. Guys, here I am given some codes, right? The code 335172523. All these codes are add-on codes, guys. So please note down. All these codes are add-on code, right? 335172523. All these codes is an add-on code. We have to follow one separate guideline to code this scenario. And one more thing, in your exam, this both artery and vein, this question only you guys are receiving in your exam. Okay. So only one guideline, please note down, guys. What does a guideline mean? The artery grafting code and the vein grafting code, we don't code together. Guys, again I repeat. Again I repeat. The artery grafting code and vein grafting code, we don't code together. Guys, this is very important guideline. For example, this one, right? Vein mean the code 335102516. This code and the artery 33533. The grafting code is there, right? In these two grafting code, if any option the provider given together, you have to eliminate that option, because as per the CPT guideline, this two grafting code we don't use together. Okay. Now what we do, sir? In case artery and vein both they mention, you said we are not coded together. Okay. Then how to code? Like that you guys having question, right? Okay. I will give you one question and also I will explain, guys. Then you guys understand this concept, right? Please note down the question. The question is CABG into 4 graft. CABG into 4 graft. 2 graft harvested from artery and the 2 graft harvested from vein. Again repeat. CABG into 4 graft, 2 graft harvested from artery and 2 graft harvested from vein. Clear? Okay. Now I will explain you guys how to code this scenario. Whenever the artery and vein, both the provider is documented, that time, first you have to code artery grafting code. Guys, tell me the answer. What is the code for 2 artery graft? What is the answer for
3
2 artery graft?
33534.
Yes, superb. So the artery 2 graft mean 33534 you have to give. Superb. So artery graft you are given. Then the provider perform vein 2 graft. Guys, very important this point. Concentrate. In this scenario, instead of using your vein code, you have to use this add-on code, guys. So the 2 graft mean 33518 you have to use. That's all. Again repeat. Your question is CABG into 4 graft. 2 from artery, 2 from vein. As per the guideline, first you have to use artery grafting code. So your artery grafting 2 code mean 33534 you are using. Then instead of using vein grafting code, you have to use this add-on code 33518. The 2 graft code you have to use. So why we have to use like this mean? Because the guidelines say the artery and the vein graft code we don't code together. So that's why we have to follow this guideline. That's all, guys. You guys clear, everyone? That's all. So whenever, if any option, artery grafting code and vein grafting code, if they are given in same option, very easy. You guys first delete that. That's all. That's all. The grafting only you have to follow this guideline. Otherwise, the harvesting everything is same only. Only the grafting you follow this. Guys, clear? That's all. And we have few guideline. What does that mean? In CABG concept, you guys, please don't use 51 modifier. This is very much important. We are not using 51 modifier. And next one, the quantity billing we are not using. Right? The quantity billing we don't use. Quantity billing mean you guys remember, right? So into 3, into 4, like that, we are not given in this CABG concept. That's all, guys. So that's all about CABG. Okay. So now you guys please note down. This is the homework question for your CABG. Please note down this and update me, guys.
कोई वाले क्वेश्चन का तेरा आंसर आ गया 73 गलत कर रहा है अरे कोई और तो क्वेश्चन होगा ना तो वो भी नहीं सेम है इसको अगर इसको करेंगे तो फिर 1 लाख आएगा 1 लाख को 2 से डिवाइड करेंगे तो 5 आएगा 50,000 तो 50,000 4 टाइम आएगा इसका आंसर 4 टाइम कैसे आ गया नहीं तो आ गया 36
Once you guys done, please update me.
क्यों इतना से इस्तेमाल करेंगे इधर को ऐड करके चाहिए नहीं आएगा तो इधर को ऐड तो भी कैसे कर दिया सही से इसका आंसर नहीं आया क्या इसका आंसर नहीं आया इसका आ गया वही तो मैं सोच रहा हूँ
Completed, sir.
मामा रात निकल रही यही फैलाइए पागल से
Okay, guys. I hope you guys are completed. That's all, right? So this question is a homework question. So after completing this session, you guys check the question and send me the answer for this, right? Okay. So this is one. That's all. So we have so we are discussing the three major guideline. So three major topic. One is CABG, and then ECMO, and then pacemaker. This is very important for your exam, guys. And next we have to discuss some of the exam question, guys. Please note down.
पीयूष का
Right? Okay. So please note down, guys. I will give you some of the question. Please note down directly. These are all the recent question we are receiving in exam. So the first one is endovascular triple A repair. The first one is endovascular triple A repair. Endovascular triple A repair. So please note down the code. Please note down the code 34701, guys. Guys, this question is a direct one, guys. I'm just to give you the exam question, right? If the product documented endovascular triple A repair mean, you give the answer 34701. And what is triple A, guys? Anyone having idea what is triple A? Anyone?
Thoracic aorta aneurysm.
Yes, right. So abdominal aortic aneurysm. Okay, so this is a direct question, guys. In case you are receiving the question, I am performing endovascular triple A repair mean, you have to give the answer 34701. And the next one, you guys please note down. The next one is bone marrow, guys. The next one is bone marrow. So bone marrow, we have three code actually. 38220, 38221, and 38222. Right? 38220 and 38221 and 222. So this is for bone marrow, guys. These are all the questions are direct leading only, but just for the knowledge purpose, I have to share. So you guys please note down. 38220 mean bone marrow aspiration. 38220 mean bone marrow aspiration. And then 38221 mean bone marrow biopsy. Bone marrow biopsy. And then 38222. This is for bone marrow biopsy with the aspiration. Actually, this 38222 we are receiving in exam, guys. If the provider documented bone marrow aspiration only mean 38220. If the provider documented I am performing biopsy only mean 38221. But whenever if the provider documented I am performing biopsy with the aspiration both together, that time you have to use the code 38222. So this is the exam question, guys. Clear? Okay. This is one question. And next one, media stenoscopy, guys. And these are the small topic only. The next one is the media stenoscopy. So media stenoscopy, we have two code 39401 and 402. Media stenoscopy 39401 and 402. So this one also same, guys. It's a direct leading only. But if you guys are not checking the question properly, we are getting error. Okay, you guys see the screen. For example, the provider documented I am performing media stenoscopy with the lymph node biopsy. Like that, the question they given. And option A, they given 39401. The candidates, whenever in exam tension, they have to check 39401. What they are thinking mean, okay, media stenoscopy including biopsy is mentioned. So, the 39401 is the correct answer. Like that, they have to imagine. And they given the answer 39401. Guys, it's totally wrong. Always remember, whenever the lymph node biopsy, if the provider is documented, that time you have to use the code 39402. Only the mediastinal biopsy is included. But in case the provider documented lymph node biopsy mentioned in your question, you have to use 39402. So don't forget. Only mediastinal biopsy is included. If lymph node is documented, you have to code it separately. That's all, guys. Clear? So endovascular triplet, bone marrow, and mediastinoscopy. And the last one is the thromboendarterectomy, guys. Right? I will show you. 35301. Okay. You guys check the code thromboendarterectomy. Guys, if you want spell, you guys please check this slide. Thromboendarterectomy. The removal of thrombus in arteries. And then the code sets, please note down, guys. The code sets for thromboendarterectomy is 35301, 35301 hyphen 35 35301 hyphen 35390. 35390. So this is the code sets for thromboendarterectomy, guys. So you guys, everyone, just go and check this code. The code 353012 35390. You guys check and tell me based on which criteria the code sets will differ. So in these code sets, based on which criteria the code sets will differ. Guys, check and tell me based on which criteria the code sets will differ. Guys, anybody checking?
Sir, on artery base.
Yeah. So based on the artery name, right? If you guys are checking this code set mean based on the artery, the code will differ. For example, so 35301, you guys see this is for carotid artery, femoral artery, like that. So based on the artery, the code will differ. Okay, so in this particular thromboendarterectomy, we have one frequent exam question, guys. What does that mean? The 35390. You guys see the screen? This is the only add-on code we have in this thromboendarterectomy. So all the artery we don't have issue. All the artery we don't have issue. It's a one time only the provider will perform. But this carotid thromboendarterectomy alone, after doing the first one, sometime again the patient getting problem. So very simple. If you want to use this 35390 code mean, you have to check when previous surgery is performed. You guys see re-operation carotid thromboendarterectomy more than 1 month after original operation, which means in case after 1 month, if the provider re-operation they are performing, you have to use the code 35390 along with the 35301, the primary code. In case within 1 month, if they are doing the procedure, now what you have to do mean you have to use 35301 only. So again I repeat, carotid thromboendarterectomy, if the provider they are doing re-operation mean you have to check when the previous one is performed. If the previous one performed within 1 month mean you code 35301, the single code, that is enough. In case more than 1 month after that they are doing this procedure, that time you have to use 35301 along with 35390. That's all, guys. So that's all about cardiovascular system. So if you guys exactly you guys will plan, and if you prepared mean in this topic also we are getting full score. So totally I am given yesterday pacemaker 3 question I am given as a homework, and then ECMO 1 question I am given as a homework, and today's session the CABG 2 question I am given as a homework. So you guys everyone after this session Whenever you guys are getting free time, you guys will check and you guys send me the answer for this. That's all, guys. So that's all about cardiovascular system. Clear? And mainly, so tomorrow we have to plan the ICD and HIPIX, guys. Right? So tomorrow we are planning ICD and HIPIX. So first few minutes we have to discuss HIPIX, guys, because the HIPIX you guys no need to put any effort. It's a gift. If you guys attend, you are getting answer. So that is the HIPIX, right? So HIPIX we have to discuss. After that, we have to discuss ICD. So ICD, you guys, everyone is already using. So guys, you only give me the answer, right? So day by day, whatever you guys are using in your ICD, the same thing only we are receiving in your exam also. So be prepared. So tomorrow we have to discuss ICD and HIPIX. Clear? That's all. So this week I will update, guys, the E&M session when we have. So I will update shortly in this week. So thank you everyone. See you tomorrow, guys. Bye everyone.